Hello, and thank you for watching our video. This video was made to teach providers how to interrogate a PCA pump. This video was made to assist providers in gathering data from a PCA, a patient-controlled analgesic pump. This video addresses the use of an intravenous PCA and does not address intrathecal or epidural analgesics. The PCA machine should be interrogated daily to ensure accurate documentation of settings and the amount of analgesic delivered. Generally, the dosage of opioid analgesic can be converted to oral morphine equivalents to provide a standard means of measuring and reporting opiate dosing. First, this is how you check the current settings on the pump. Click on any button to bring up the home page. Here, you see the medication and its concentration. There will be 4 settings listed for the PCA machine. First is the continuous rate. This is the basal rate of analgesic administered. Not all patients require a basal rate. Next is the PCA dose. This is the as-needed dosage of analgesic delivered by pressing the button. Next, you see the PCA lockout. This is the minimum amount of time that must elapse before the next PCA bolus can be delivered. Lastly is the reservoir volume, which shows the volume of medication left in the cassette. This is important for patients at home who have infrequent cassette changes. Next, to see how much of the medication has been administered, click on the Reports button. Click on Delivery, History, and Pie Charts. This screen will show you how much medication has been delivered over the time frame noted on the screen. You are able to scroll and change the time frame. The time frame can be changed up to the past 96 hours. On this screen, you will see 4 different measurements, including continuous rate, PCA dose, clinician bolus, and total given. The continuous rate is the total amount of medication in milligrams delivered from the basal rate. The PCA dose is the total amount of medication in milligrams delivered as PRN boluses after the patient pressed the button. The clinician bolus is the amount of analgesic administered by the provider outside of the previously described methods. This is rarely used. Lastly, the total given is the total amount of analgesic administered over the denoted time period. Here, you will also see a pie chart, which indicates the percentage of medication administered as a continuous rate versus the percentage of medication administered as boluses versus the percentage of medication administered by clinician boluses. We recommend daily documentation of the current settings and the last 24-hour total dosage administered. To access information about the number of times the patient presses the button and the number of times a PCA dose was given, go back to the Reports page. Click on PCA dose graph. Here you will see a bar graph which shows the amount of medication delivered over the past 8 hours as a PCA dose, as well as the amount of attempts which occurred during the lockout period. This can be a useful tool to determine if the PCA is being used appropriately. If there are multiple attempts during the lockout period, this is likely a sign of suboptimal use. There are multiple issues that could be occurring. For example, the dosage of the bolus may be inadequate, leading to multiple attempts during the lockout time. Another example is the patient may have been told to push the button every 10 minutes or when the color on the button changes, regardless of their pain level. The patient should only press the button when having pain and requiring a bolus of analgesic.